With more, I'm joined by Dr. Zain Chagla. He's an infectious disease specialist. Dr. Chagla, glad you could be with us. To help put our breaking news into perspective, we hear 700. People are texting me and saying, what the heck is going on in Ontario? What's your take on today's case count?
I mean, there's a couple of things. One is, yes, we are seeing more case transmission, and it seems to be much more in the Greater Toronto area. The other thing is, as we were very well aware of, there's been a large testing backlog that's been ongoing for a number of days. And as we start eating into that testing backlog, we're going to see more cases. It's not like they disappeared. There are cases hidden in all of those cases that have been delayed more than a day or two. So as we're getting more efficient, I think we're starting to see more cases show up, but certainly there are more cases transmitting in our community too.
Okay, well, there's a lot of people who are really going to appreciate your balanced tone because, again,
Mhm.
we hear that number and we kind of freak out and we say, how can we have more cases now than we did back in the beginning of this pandemic moving in?
And I think it's important for people to take this in context. The beginning of the pandemic, we did not test everyone that had COVID-19 symptoms. We saved it for the vulnerable, long term care, hospitalized, post travelers. We really didn't test the person with a febrile illness in the community who could self isolate at home. So, some of the projections of what were in the community were 5 to 10 times higher than the number of cases we actually saw. So that 400 back in March was probably 2,000. These numbers are certainly something getting bigger, but they're certainly not approaching what we saw back in March and April. It was just an underestimation.
Okay, I want to underline that statement. That's so important to share with us. So, Dr. Chagla, Ontario announced new measures last week to flatten the curve. They're reducing the hours at restaurants and bars. Other measures are being put into place. Do you think that that is going to be enough right now?
Yeah, I mean, time will tell. And part of the worry now is we've instituted more measures and the tests are going up. But it's important to know what we're seeing now is a reflection of what happened in our community 5 to 10 days ago. So whatever is coming out in the next few days is kind of predestined as those events happened before these new restrictions came in place. I think we still have some time to work on things. And I think we do need to be brave and try to close things or restrict things relatively science and evidence based, knowing that we're going to see ebbs and flows. But I think we'll probably have a good sense towards the end of this week whether or not those new restrictions coming into place are actually having an effect, or more that needs to be done to get things under control.
And lastly, what has been consistent is the age group of the people
Mhm.
that are now testing positive for COVID-19. It's people under the age of 40. What is your message to them who are still getting together? We saw over the weekend in Wasaga Beach that massive car rally. What do you want to say to those folks who are sloughing it off because they think it won't affect them, or if they get it, it won't affect them as badly as it might a senior?
Look, this is a tough group. It's been a tough group globally. It's not just an Ontario issue. It's been around the world. I think people have pointed the finger at some of the more egregious events, but the reality is these are happening in under 40-year-olds' workplaces. They're happening in under 40-year-olds, mixing at home, roommate situations, families. So it's not a particular demographic of a 40-year-old that's at risk. It's all of us in that sense. So, I think people still need to be very consistent. They need to consider socializing outdoors if they're going to meet people outside of their household. They need to consider their coworkers at risk of COVID-19 and not, let their guard down as we saw in the hospitals. And I think we just need to focus on what we're doing in our own environments to reduce the rates, not just these big egregious events that capture more of the spotlight.
Dr. Chagla, thank you so much. I know you're super busy, and I'm really glad that you were able to join us this morning.